Okay. So low BP, young age tends to remain low even after reaching adulthood. So 10 years, 20 years, 30 years, if your systolic BP had been only 60, it tends to remain around that range even after you reach adulthood. Or if your systolic BP has been high, it tends to remain high. So what is this phenomenon? Good guys, good. All of you are okay with this? Yes. This phenomenon is known as the tracking of BP. It is called tracking of BP. So what is tracking of BP? At young age, if the BP has been low, it remains low throughout the age. Then if it remains high, it remains high. So by having an individual being screened at various ages at 10 years, 20 years, 30 years, we can detect hypertension or hypotension yearly, and we can start treatment yearly according to the type of BP they have. So this phenomenon is called as tracking of BP. So what is this WHO steps approach? So only thing you have to remember, don't remember many things. It is like a questionnaire. WHO gave a questionnaire. So for what they gave a questionnaire? It is a questionnaire to identify the risk factors for non-communicable diseases. So what is this questionnaire all about? It's to identify the risk factors for non-communicable diseases. Why it is called as a steps approach? Because we have 3 types of questionnaires. So in one, they will just ask only the questions, and then in another, they will ask mainly about our anthropometric measures like height, weight, BMI, and in the third, they will mainly talk about the biochemical parameters like our lipid profile. So mainly it is like the lab test. So it is like the lab. So these 3 steps, just the general questions, anthropometric measures, lab test. So since we are doing step by step, it is also called as the WHO steps up. Then rule of House, it is used in hypertension. As you all know, rule of House, it is used in hypertension. So totally in India, half of the people are hypertensive. Out of the half of the people with hypertension, only half of the people know that they are hypertension. Out of this half of the people, only half they are being adequately treated. So like this, half. So iceberg phenomenon. So as you see, like a Titanic ship hitting, only the tip of the iceberg we are seeing. Most of the diseases, non-communicable diseases, they are being hidden. The doctors do not see them. Only the doctor is seeing only a fraction of the diseases in the community. So in order to take them out, we use what test? We use screening test in order to unearth the hidden part of the iceberg. Okay? Next question. The source of infection and reservoir of infection are the same in which disease? The source of infection and reservoir of the infection are same in which disease? The source of infection and reservoir of the infection are same in which disease? Good. So the source of the infection and the reservoir of the infection are same in only one disease, that is in tetanus. So in tetanus, both the source of the infection as well as the reservoir of the infection are same. So what is the reservoir? What is the source? So reservoir, it is like a factory. It is like a factory which you put shoes and many things. No, it is like a factory. The shows is like the shop. The shop in a mall. You are going to a mall. In a mall, there are many shops. In a mall, there are many shops. But where does the shoes or the slippers come? It comes from the factory. So the manufactured in a factory, they come to the shop in a mall where you buy it. So this is like a maybe a reservoir is like a animal. In this animal, a virus is being produced. Then this animal is coming and maybe touching or sitting in a chair or in a stool in a park. When you go into the park and come in contact with the stool, like a chair or a stool, when you come in contact, you get the infection. So, but for one disease, both of them are same source of infection reservoir. That is for tetanus. Because in tetanus, the tetanus spores are present in the soil. Then What is their reproductive form? That is called as the vegetative form or also present in the soil. So they reproduce in the soil. We get the tetanus also from the soil. So the soil is both the source of infection as well as the reservoir for tetanus. But for all other diseases, if you see, the source of infection and reservoir can be different. The source of infection can be, the reservoir can be a human being. So the reservoir can be a human being, someone who produces or in which in him the microorganism is multiplying. Then the human being can give you the infection through a pani puri. So typhoid, when you go and eat a pale puri or a pani puri from a shop, where the worker can give you the typhoid. So this pale puri or pani puri, it can be the source of infection. The reservoir can be a human being. Okay, next question. I give the answer for this. The average number of children a woman would have if she were to pass through her reproductive years, bearing children at the same rate as the woman now in each age. So what is the question being asked? What is the average number of children? A woman is there. Okay, a woman is there. The average number of children she would have if she were to pass through her reproductive years. So what is her reproductive years? Like 18 to 45 or 49 years. There are two standards. So the reproductive years is like from 18 to 45 or 49 years. So during this reproductive years, how many children she is going to have on an average? How many children she is going to have on an average? On an average, Indian woman will have how many children? 2 children. So Indian woman will have 2 children on average, bearing the children at the same rate as the woman now in each age group. Considering the averages, how many children a normal Indian woman would have during her reproductive age is called as the TFR or the total fertility rate. So normally TFR, what is our aim? What is our aim or target of TFR according to our national population policy is 2.1. So this we have achieved. So what is our target for TFR? Total fertility rate is 2.1. So why it is 2.1? So normally a family should have 2 children. Why it is 2.1? Because some children may die. Infant mortality rate. So to adjust that, they are keeping it as 2.1. So if the TFR or total fertility rate is 2.1, we can assume that normally a mother will have how many children born to her? 2 children born to her during her reproductive age. So during her reproductive age, 2 children will be born to her. So 2.1, it is for any death we are adding this 0.1. That is called TFR or total fertility rate. That is also our aim of national population policy is a TFR of 2.1. We have achieved this according to which National Family Health Survey 5. According to the recent survey NFHS 5, we have achieved the TFR of 2.1 on a national level. So how are we getting the TFR? So we get the TFR by adding the ASFR of various age groups. What do you mean by ASFR? ASFR means age specific fertility rate. What is ASFR? Age specific fertility rate. For each age group, we have specific fertility rate. 15 to 19 years, how many children are being born? 20 to 24 years, how many children are being born? Till up to 45 to 49 years, how many children are being born? So when we add every ASFR, we get the TFR. So how we are getting the TFR? TFR is computed by summing the age-specific fertility rate of all age groups. By summing the ASFR of all age groups, we get the TFR. So NRR is nothing but net reproduction rate, that should be equal to 1. So what is NRR? NRR is nothing but normally how many children a mother should have? 2 children. Out of these 2 children, how many should be girls? It should be 1. This is the NRR. What is NRR? How many girl children a mother will have? Today, a newborn girl. Today, for example, we can take like Naintara. Naintara is having a girl baby born today. How many girl children will be born to the girl baby born to Naintara if they go through the normal reproductive cycle and normal death rates and normal fertility rates. That is called as the net reproduction rate. Number of girl child alone is they specify, that is net reproduction rate. Total number of children, that is total fertility rate. Okay, next, answer this question. The lifespan in Japan is 85 years. This longest lifespan among the people in the world is used in the calculation of. Someone raise someone. Okay, okay, good. Good answer. Good. So this longest lifespan is used in the calculation of. So this we have many people have two options here: life expectancy at age 1 and DALI. But the better option is DALI. Is why? Because it is like a indicator. So DALI is like an indicator. But life expectancy at age 1 is like only a small variable for calculating an indicator. So I prefer the answer DALI more than life expectancy at age. So both are correct. Both are, if you see, logically correct. But if you see as an indicator, which is more important for us, DALI is more important. DALI gives the final answer. So as an indicator, if you see, which is more important is DALI. So what is DALI? DALI is nothing but disability adjusted life. So all of you know, we can calculate both with this life expectancy at age 1 and DALI. But which is more important for us? Because DALI is important because it is like a final value. Life expectancy at age 1 is like an intermediate value. So we want to have the climax. We want to know the climax, or the whole we want to have the output. Which is the output here? DALI is the output. With DALI, we can compare countries. We can compare India with America, India with Pakistan. So only I'm choosing DALI as the answer here. So PQLI, SPI and DALI. So what is PQLI? PQLI is physical quality of life index. So what are the three things in PQLI? So we use three things to calculate PQLI. These three things are: first is IMR, death between 0 to 1 year of age. Then the second indicator to calculate the PQLI is life expectancy at age 1. Then third one is literacy rate. IMR, then at 1 year, how many years it is going to live. Then third one is literacy rate. So the final answer we get is between 0 to 100. 0 to 100. Then HPI, what is HPI? HPI is Human Development Index. So what are the three indicators in the Human Development Index? We use three indicators. Here what we do, we take the geometric mean. So what we are doing, we are taking the geometric mean. Geometric mean what? We take the three things, 1 into 2 into 3. So the three things we are taking the cube root. So only it is called the geometric mean. Since we are taking the geometric mean, the answer will always be between 0 to 1. It will be between 0 to 1. So what are the three things here? Here we combine both this IMR and life expectancy at age 1 into single. That is life expectancy at birth. We are combining it into single. Life expectancy at birth. Second one is mainly about knowledge. So in knowledge, we have two components. One is mean years of schooling. Then is expected years of schooling. So mean years of schooling, then expected years of schooling. The third one is mainly income. Here we do not have income, but here we have income. So it is calculated as per capita for one person. How much is the earning amount? Gross national product. It is calculated in terms of US dollars. Per capita GNP, gross national product for one person. How much money it can be earned by one person in India? Per capita gross national product in US dollars. So this is the difference between PQLI and HPI. So what is DALI? DALI is disability adjusted life years. Here we have two components for DALI, for making up DALI. So these are the two components are YLL plus YLD. So YLL. So if someone is there, for example, we can take an actor, a famous actor is there. His age is now 50 years. Normal life expectancy is around 80 years, but he dies today. So how much years of life is lost? 30 years of life is lost. Already he has lived because of some accident 5 years in a wheelchair. So 30 years of life he died yearly. Then 30 years, 5 years he has been in wheelchair. So 30 plus 5, 35. So the total amount of daily for him is 35. So years of life lost plus years of life lived with disability. Years of life lost plus years of life lived with disability. So this is called daily. For example, so 80 years. So he has died at 50 years. So 30 years will be the YLL. So YLL will be 30. Then he already had between 35 to 40 years, he had an accident and he was in bed. So YLD is 5 years. So total DALY is 35. This is how we calculate the DALY. So next, according to the recent, so recently 2023 and 24, they released the DALY. They released the HCI, Human Development Index. So what was the score of India was 0.64 for 2023 to 24 report. According to the 2023 to 24 report, they calculated it for 2022. In this recent report, India's rank was 134. So India's score was 0.644. So India is in which category? It is in medium development category. So according to Human Development Index, according to the 2023 to 24 report, which was released recently, according to this report, so India's score is around 0.644. It comes under which development? Medium development. Medium development. Comes under the medium development category. Next, answer this question. In a cohort study, the strength of association between green tea intake and diabetes mellitus was 0.8. What is the impact? That's good, 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 good. Very good, very good, very good. So you are all awake and happy. So what happened here? The relative risk. So what is this thing in cohort study? In cohort study, we have something called as the relative risk. We have something called as the relative risk. So what is relative risk? Incidence in exposed divided by incidence in non-exposed. So here relative risk is less than 1. If the relative risk is less than 1, then it is what? It is not a risk factor. It is a protective factor. Your relative risk is less than 1. It is not a risk factor, but a protective factor. So green tea, it is a protective factor for diabetes mellitus. It decreases the risk of diabetes mellitus. In case a relative risk was more than 1, then it is a risk factor. Relative risk equal to 1, then it is no association, neither a risk factor nor a protective factor. Like even if you love Aishwarya Rai, she doesn't know about you. That is like no association. No association. She doesn't even care about you. So no association. Relative risk equal to 1. So this is the cohort study. This is the time and the direction of inquiry. So always we are going forward from 2024 to 2034. So only the cohort study is called as a prospective study. So in the cohort study, we always start from a population, from the people without the disease. Then we give some follow-up time. Then we are dividing them based on the exposure status. Then we are giving some follow-up time, like 5 years or 10 years. So based on the exposure status, we are divided into exposed groups and not exposed groups. Then after the follow-up time, we are dividing into 4 groups: disease, not disease, disease, not disease. Among the exposed, we have 2 groups. Among the not exposed, 2 groups. So we are forming a 2x2 table. This table is called as the 2x2 table. So disease always, the God gives the disease. So disease plus, disease minus, exposure plus, exposure minus. So always we write from left to right, A, B, C, D. So this is how we form a 2x2 table. So what is the relative risk? So what is the incidence among the exposed? It is A by A plus B. What is the incidence among the non-exposed? How many people are non-exposed? C plus D are non-exposed. Out of this, C got the disease, C by C plus D. So this is the formula for relative risk. A by A plus B divided by C by C plus. So this is the 2 cross 2 table, A, B, C, D. So this is called as the 2 cross 2 table. So why it is called as a 2 cross 2 table? So 1, 2. So we have first row, second row, first column, second column. This 2 cross 2, 3 cross 3 will be used in calculating degree of freedom. You will see this in a chi-square test. In a chi-square test, you have to calculate the degree of freedom. What is degree of freedom? Number of rows minus 1 into number of column minus 1. In that question, you will see this degree of freedom question. You have to calculate how? Number of rows minus 1 into number of column minus 1. Okay. Yes, good. What is the degree of freedom for the present question? For the present question, the degree of freedom is 2 minus 1 into 2 minus 1, that is equal to 1. Okay, good. That is good. So 2 minus 1 into 2 minus 1. Yes, what is the degree of freedom for the present question? It is 1. So what is the relative risk? Relative risk is equal to A by A plus B divided by C by C plus D. A by A plus B divided by C by C plus D. How we are calculating incidence in exposed divided by incidence in non-exposed. Relative risk more than 1, then it is a risk factor. Smoking causes MI. Relative risk less than 1, it is not a risk factor. Physical activity decreases the risk of MI. So, but equal to 1, there is no association. Idli has no association with MI. Next question. In a PHC, 1 vial of pentavalent vaccine and MR vaccine are open. So this is penta and this is MR. After the vaccination session, what we have to do? Both must be discarded, MR must be discarded, penta must be discarded, both must be preserved. Okay, this is good. So many times it is a repeated question. So MR must be discarded. We have MR must be discarded. Why? Because it is called as the open vial policy. So what is open vial policy? When a vaccine vial is opened, it can be used up to 28 days. We have to put the date on the vial. In this, we have to put the date. And we have to put use up to. In the label, we have to paste the label, date, use up to. How is this applicable? We have to store all the vaccines in the proper temperature recommended by the WHO so that the stability and effectiveness are met. But use this open vial policy, it is usually not applicable for what vaccine is reconstituted vaccine. What is reconstituted vaccine? Vaccine will come as a powder. In this powder, we are adding some water or some diluent. Then we are mixing it and we are getting it as a vaccine. This is called as a reconstituted vaccine. Usually, generally, for reconstituted vaccines, we will not use this open vial policy. So, what are the vaccine vial policies we will not use? That is MGRJ. So, MGRJ. So, what is this MGRJ? MGRJ, M stands for measles. G stands for BCG. R stands for rotavirus. J stands for JE. Japanese encephalitis. This is the MGRJ. For these vaccines, usually vaccine open vial policy is not applicable. Open vial policy is not applicable. But recently one development has happened, rotavirus. So recently the government of India has been releasing rotavirus. Like instead of giving it in a vial, they are giving it like a small vial which is enough for a one child. So like it will be very small and elongated like this. Like this, one thing is enough for one child. So if they are giving like that, then at that time open vial policy, there is no need of open vial policy because they are giving this formulation which is ready to be given for only one child. This is the recent formulation of rotavirus vaccine given by Government of India. But as a general rule, open vial policy is not applicable for NGRJ, measles, BCG, rotavirus, JE. So why this comes? Because one vaccine vial, for example, it will have 5 ml. So for one child, the dose can be only 0.5 ml. So we can give it for 10 children. Okay. So we can give one vaccine vial for 10 children. For 10 children we can give. But for today, to our immunization site, only one child is coming. Then what will happen to the remaining 9 doses? That is called as the open vial policy. So except for these vaccines, all other vaccines, we can store the vaccine up to 28 days. But for these vaccines, depending on the vaccine, it can be maximum only 2 to 4 hours only. We can keep it. After that, we have to discard. Maximum is 4 hours. After that, we have to discard. So it is applicable for DPT, TT, hepatitis B, OPV, PCV, IPV liquid, but it is not applicable for our MGR. In this rotavirus alone, recent formulation is given as a single child formulation. That is, recent formulation is given as a single child formulation. For single child, they are giving as a 1 vial dose. And 1 dose formulation. So at that time, there comes a no question for open vial policy. The next, washing hands for preventing COVID-19 comes under what type of prevention? So washing hands for preventing COVID-19 comes under what type of prevention? So here only what is the mistake most of you make is, most of you put it as primordial instead of primary. But the best answer is primary. I will tell you why. Okay, very good. The best answer here is primary. Why it is not primordial, I will tell you. So primary is like, so we have risk factors, disease, and complications. So if you prevent the development of risk factors, it is primordial prevention. This primordial prevention. For example, here primordial prevention can be by preventing the entry of COVID-19 into India by strict surveillance. That could have been a primordial prevention, but in India, the COVID-19 has entered inside India. It has entered inside India. So now the risk factors are there. Now we are preventing the development of the disease. That time it is called primary prevention. That time it is called primary prevention. We can do by 2 ways. So health promotion, like we can tell to wash your hands regularly, wash with soap regularly. Health promotion. Specific protection is putting vaccine for COVID-19 comes under specific protection. So this comes under primary prevention. So this comes under the primary prevention. So washing hands for COVID-19. So this mainly comes under primary prevention is a better answer than primordial. Why? Because primordial means we should have prevented the entry of COVID-19 into India by strict surveillance. We did not do that. So it has entered inside. Now we are all having some risk. So COVID-19 is there, circulating in our environment. So we have to prevent the disease by washing the hands or by putting the mask. Putting mask for preventing COVID-19 also comes under primary prevention. So although there is a interlap between various levels, the better answer, the most better answer is primary prevention. Then preventing the disease to complications, like diagnosing in the early stage of the disease, and then preventing the complications, then we can do this called as the secondary prevention. Then that is called as the secondary prevention. Then after we get complications, if we do prevention, then it is called as the tertiary prevention. Here in tertiary prevention, we can do rehabilitation. Like for a person who has an amputated leg, we can give an artificial leg, or we can give him a new job. That is rehabilitation. Or in a case of a polio child, already the child is having some leg paralysis. We can prevent further damage to the paralyzed leg. You can prevent further damage to the paralyzed leg by giving a support to the child. So that is called disability limitation. So risk factor, if you prevent risk factor, here it is primordial prevention. And if you do here, it is primary prevention. So here secondary prevention. Then in the advanced stage, we are doing tertiary prevention, that is rehabilitation or disability limitation. Okay, next question. In a country with high burden of oral cancer, an act was passed to restrict the use of tobacco. This type of prevention. So in a country with high burden of oral cancer, an act was passed to restrict the use of tobacco. To restrict the use of tobacco, like in our country, children less than 18 years should not smoke, or it can be like smoking in public places, you will be jailed, or you will have some fine. So this is like restricting the use of tobacco. We should not smoke in public places. What type of prevention is in a country with high burden of oral cancer, that was first to restrict the use of tobacco. So we are having tobacco use. So tobacco use, it leads to oral cancer. So the disease is oral cancer. So risk factor is tobacco use. So what they are telling, in a country with high burden of oral cancer, so in our country already tobacco use is high. So they are only restricting. So read this sentence, restricting the use of tobacco. So we already have tobacco use. We are already having the risk factor. They are only restricting the use of tobacco. That is, they are only modifying the risk factor. So already a risk factor is present. You see here, already a risk factor is present. So in case if we ban tobacco, then it could have been a primordial prevention. Ban tobacco. But here what we are doing, we are just only restricting. Restricting the use of tobacco. Restricting the use of tobacco. So I prefer the answer to be more of a primary prevention rather than primordial prevention. Here we are not banning tobacco completely. In case if we have been banned the sale of tobacco, that could have been primordial. But here we are only restricting the use of tobacco. So I prefer the answer here to be primary more than primordial. Can you understand why I put the answer to be primary? Because here we are only restricting the use of tobacco. In case banning the tobacco use, then you could have told it as primordial prevention. Okay guys, can you understand? Sir, if you do prospective screening in airport for COVID-19, whether it comes under primordial or secondary. Okay. So that is the question asked related to this question. So the question we are being asked is prospective screening for COVID-19. In the airport. So usually in the airport, what they are doing, it is like screening. So they are doing screening. So the person who is coming, he is being screened. So what is screening? It comes under early diagnosis and management. So what does screening comes under? Early diagnosis and management. Usually it comes under the secondary prevention. It comes under what prevention? Secondary prevention for the person who is being screened. So in case if the question is simply like this, you can put secondary prevention. But if it is secondary prevention for this person, so what does it mean for other persons? So for other persons, it can be primordial. So because other persons are prevented from even having the entry, or even they are prevented from being exposed to the risk factors. So for other persons, it is a primordial prevention. But as per the question, the answer is secondary prevention for a person being screened. The person is screened, that means what we are doing, the intervention done is early diagnosis So what does it come under? It comes under secondary prevention is the best answer. In case they ask, so it is secondary prevention for the person who is being screened. It is what type of prevention for other people who are coming to the airport. For other people, it could be primordial. Okay, doctor? Yes. Screening is secondary. So the best answer is secondary prevention. Next, a study was conducted on children with and without autism. So this is children with autism, then without autism. So what we are doing, we are seeing for history of MMR. So long time back, I think in Europe or some other country, with a lot of MMR vaccination, they got autism as a side effect. So they are seeing as a study, children with autism, children without autism. How many put MMR? They are doing this like a study. So whether they are going forward or whether they are going backward. So what type of studies do? Whether they are going forward or whether they are going backward. So now in 2024, we are all checking the children with autism, and we are checking in 2014 or 2010 whether they put MMR vaccine or they did not put MMR vaccine. Since we are going back in time, this type of study is called as a good. So this type of study is called as a case control study. So this type of study is called as a case control study. Retrospective study, since we are going back in time. This is a retrospective study. So 2024 we are here. So cases with autism, controls without autism. With autism, without autism. Then from these people, we are segregating as those who are exposed to MMR, those who are not exposed to MMR. Then without autism, MMR exposed, MMR not exposed. So we are going back in time in the last 10 years. So we are seeing, so how many groups we are getting? We are getting 4 groups, A, B, C, D. So what we are doing in this case control study, we are doing cross multiplication. What is the outcome of interest in a case control study? It is called as the odds ratio. So what is the odds ratio? It is also called as the cross product ratio. So always we write in the exam from left hand to right hand. So always A, B, C, D. So never ever confuse A, B, C, D. So what is the odds ratio or the cross product ratio? AD by BC. So they will ask you also sometimes another question, whether this odds ratio is exposure odds ratio or a disease odds ratio. Exposure. So mainly the better is exposure odds ratio, because in case control study we are only calculating about the exposure. So you can choose exposure odds ratio. It is a more preferential. So we call it as both as exposure odds ratio and a disease odds ratio. In case if they want you to choose between which type of odds ratio, you can choose that exposure odds ratio. So odds ratio has 2 different names: exposure odds ratio, disease odds ratio. One backward case control. Yes, forward is what, backward is case control. Okay, according to biomedical waste management rules, the vaccine vials are discarded. According to the biomedical waste management rules, the vaccine vials are discarded in which color? So the vaccine vials are discarded in which color? Okay, good. So the vaccine vials are discarded in blue color. The first blue color, it is mainly for glass and metallic implant. So what does this metallic implant mean? Like our hip implant or a knee implant. Hip means like we keep like this, no, in our hip joint. Hip implant, knee implant, glass vials. So always remember, glass with cytotoxic material. What is cytotoxic material? Anything which can affect our genes, which can modify our genes. Any glass which is having some cytotoxic material, it should come in yellow. So this you should remember, glass with cytotoxic material should consider only in yellow. Only empty glass or vial without cytotoxic material. Cytotoxic material is like some cancer drug. Some cancer drug is within a glass vial. Then we should not put in blue. We have to put in yellow. So anything which has cytotoxic material, it should come only in yellow. So glass means what are the glasses? Ampule, vial. These are all some of the examples of the glass. So our categories of waste. So vials with expired vaccine. So expired vaccine, if it is cytotoxic, only yellow. Otherwise, no need for yellow. So only when cytotoxic materials, only cytotoxic materials. Cytotoxic means which can affect the genes. If it is having capable of affecting the genes only. So usually vaccines, they will not have cytotoxic effect. So no need. Vaccine vials, after emptying, you can put in blue color only. So type of waste, human anatomical waste. So human anatomical waste, animals anatomical waste, any waste which is soiled, like a cotton which is soiled with blood, expired medicines, discarded medicines, then chemicals, discarded linen, mattress, then any cytotoxic waste. So any cytotoxic waste, microbiology, biotechnology, other clinical lab waste, everything should go in yellow color container, yellow color plastic bag. This bag should be this symbol. This symbol, it should be non-washable. It should be non-washable. Then, according to the recent management rules, we are using non-chlorinated plastic bags. What type of plastic bag we are using? We are using non-chlorinated plastic bags, and all this bags should have this symbol. What is this symbol? Kung Fu Panda symbol. It is called as the biohazard symbol. Biohazard symbol. Then, in our hostel, we also generate the liquid waste. So the chemical liquid waste will also come under the yellow category, but here we will not collect in bags. We have a separate collection system. Then red color, mainly red is mainly for recyclable. Red is for recyclable. So mainly for recyclable plastics, we remember as red color, recyclable plastics. What are recyclable plastics? Bottles, IV tube, like IV tube, rail tube, IV sets, IV tube, rail tube, IV sets, catheter, gloves, catheter, gloves, urine bag, and then syringes without the needle. So syringes without the needle, this part. We have to put in red color, mainly red, mainly for recyclable and for plastics. Next, we are coming into white color. So white. So that discard the vaccine vial which do not follow open vial policy. So you can discard it in yellow color. So vaccine vial you can blue color. So vaccine vial you can discard in blue color. Vaccine vial, vaccine vial, blue color. Vaccine vial, blue color. Only we have some cancer drugs or some things which are capable of cytotoxic affecting our genes, only we have to go to yellow. So this vial, it is having some cancer drug that is cytotoxic. It is capable of cytotoxic affecting our genes. Then only we have to go to yellow color. Vaccine vial not empty, anything you can put in blue color. Then white or translucent waste shocks, including the metals, mainly the metal spots, waste shocks. Here we will not use bag. Here we will not use bag. We are using a container. It has a translucent, puncture-proof, leak-proof, tamper-proof container. So blue color, glass or metallic body. Okay, next question. According to WHO, the minimum government expenditure on health. So broken vial in blue or white. So broken vial you can put in blue. You put in blue. Okay, right? Broken vial you put in blue. Broken vial you put in blue. Waste shops, mainly metals. Metals only goes to white. Waste shops, metals. Metals only goes to white. Because why we are not seeing like that is because the process is different. See here the process. Yeah, the process is different. It is mainly for metals. This process is mainly for metals. Okay, this process is mainly for metals. So you don't think a glass which is broken, which is sharp, we should put in white. No. Glass, if it is broken or not, always it should come in blue only. The process is different. So previous page, okay. So I think the video will be there after. Don't worry. You can see because all are there. So I will also send you the notes. Okay. Don't worry. Next, according to the WHO, the minimum government expenditure on health as a percentage of GDP for achieving universal health coverage should be. So what should be this? The minimum government expenditure on health. So how many percentage for achieving the universal health coverage? Any ideas? Okay, guys, good. Pipette tips. So pipette tip sterilization method, I'm not sure, Dr. Sabri. I will just refer. Sterilization method, I'm not sure. You can also consult the microbiology faculty. So I will refer and tell you. Pipette tip sterilization method, I will try to refer and tell you. Okay. So it is, yes, you are right. It is 5%. It is 5%. So the answer is 5%. According to WHO, the minimum government expenditure, GDP is gross domestic product. So out of our total budget, they are telling 5% of budget should be spent for health related expenditure. But how much is our country currently spending? Our current scenario is only 1.3%. But what is the thing recommended by WHO? WHO is recommending 5% of GDP to be spent on health. It is recommending 5%. So what is our country trying to do? According to our national health policy, so NHP is national health policy. We are trying to improve that from 1.3% to about 2.5% by 2025. By 2025, we are trying to increase. So 2025 only, we are trying to increase by 2.5%. But what is the WHO recommendation? We have to spend 5% of our budget of GDP on health. That is the recommendation by the WHO. So we are recommended 5%, but we are currently spending only around 1 or 1.5%. So we are targeting to improve to at least 2.5% by 2027. These are the various countries. If you see United States, and they are all spending around 10% in the next. A child is suffering from the following nutritional disorder. So what is this disorder do? A child is suffering from the following nutritional disorder. What is this disorder do? You can see big belly. So there is a edema. What is happening? Edema, and you can see the skin, you can see the prominent veins because of the elongated edema, abdominal distension. It is definitely kwashiorkor. Good guys, good. So it is definitely what? It is definitely kwashiorkor. So it is definitely kwashiorkor. So this is the difference between the both marasmus and kwashiorkor. They are all energy deficiency disorders. So marasmus and kwashiorkor. So here it is mainly energy, here it is mainly protein. So they come under the spectrum of protein energy malnutrition. So it is energy deficiency only. Here with along with energy, you also have the protein deficiency. So although the kwashiorkor babies looks like a normal weight or more weight, it is actually having malnutrition. You always tell a small baby, a cute baby looking chubby. No, the chubby babies may also have malnutrition. They could have been in kwashiorkor. How we can find? They will have fatty liver. They will have edema of the liver. They will have a protuberant belly, and they will have a itchy rash. And if you see the skin, they will have some dry skin, xerosis. They will have a dry skin and poor wound healing. It is in kwashiorkor. Kwashiorkor. It is a nutritional edema, but the weight may seem normal. because of the edema. In marasmus, it is like a baby which has undergone like a severe, like you have seen pictures of some babies in Africa where a eagle is coming and sitting near a baby, and the baby is very much malnourished. That is the marasmus. Marasmus, like monkey pants. Monkey pants means the skin and all, it will be very, very loose because of the loss of the muscle, subcutaneous fat, muscle loss. It will be like a very, very loose skin. Monkey pant. They will tell you like a monkey pant. They will put like a very, very loose pant now, like this monkey pant skin. The bones will be very prominent because of the energy deficiency, marasmus and kwashiorkor. Energy deficiency, protein deficiency. Here edema is present. Here subcutaneous fat is preserved. So here only there is wasting of muscle. Then fatty liver. Fatty liver is present only in kwashiorkor. Fatty liver is present in kwashiorkor. Next, in which stage of demographic cycle birth rate is highest? So there are many stages. Among the following, in which stage of demographic cycle the birth rate is highest? So how we are following the demographic cycle? The demographic cycle stages are defined based on the crude birth rate and crude death rate, the difference. So based on this, we are telling which stage of demographic cycle we are in. So demographic cycle, it has many stages. Okay, we are getting the answer. High stationary, yearly expanding, late expanding, low stationary, and declining. These are the 5 stages. So these are the 5 stages in our demographic cycle. High stationary, yearly expanding, late expanding, low stationary, declining. See, yearly in 1900s and all, many births and many deaths. Many births, many deaths. So our grandmother, grandmother, grandfather, they had 10 children, 15 children. But the population did not grow. Why? Because births is equal to death. So the population did not grow. Even if they had 15 children also, 14 children will die. So that is also high stationary. Then slowly there was development of science, yearly expanding. So increased births and deaths started to decrease. So births more than deaths. That is only yearly expanding. Then slowly many countries recognized. So population is exploding. So they developed many population control methods. So the number of births also decreased. The number of deaths also decreased. But people were dying very less. But births were more. Here also the births were more than deaths. So here, if the 100 children are born, 60 people died. But in the next late expanding stage, they reduced the births to only 50 children. But deaths also got reduced to 30. So ultimately, the births were more than deaths. So the population was expanding. So that is called as the late expanding. So India is in which stage? India is in the late expanding stage. So India is in the late expanding stage. Then low stationary. Low stationary means for some country mainly like maybe like Australia we can take, or some other country maybe like France we can take, where the births and deaths are very low. 10 births, 10 deaths. So birth is equal to death. Then declining stage, some country like maybe like a Switzerland. If you go to Switzerland, if you see the birth is 2, death is 10. So deaths are more than birth. So people are dying more. They are not giving rise to children. So why we can live happily? Why we want to have children? So that is declining. So what they are asking question, in which stage of the demographic cycle birth rate is highest? So no, declining is not. So late expanding, high stationary, no, no. In high stationary only the birth rate will be the highest. The birth rate will be highest, 150. The number of births will be highest in the high stationary. So which one of these gaps have a narrow gap of difference? Okay, another question is this. Which one of these gaps have a narrow gap of difference? So which one will have a narrow gap of difference? So narrow gap of difference is mainly it will be with low stationary or maybe late expanding. So the narrow gap of difference you can take like see high stationary, low stationary. Here the difference can be zero. So high stationary and low stationary, the difference will be zero. So for declining, it will be in minus. So if you want exactly the narrow gap, it can be high stationary or can be low stationary. That means the difference is zero. So there is no single answer for your question because both here and here the difference will be zero, high stationary and low stationary. Okay, right? So high stationary, high birth rate and high death rate. Early expanding, death rate to decline, birth rate remains unchanged. Late expanding, death rate declines further, birth rate begins to fall, but the birth exceeds death. So India is in which stage? India is in the late expanding stage. Low stationary, low birth rate and low death rate, almost stationary declining, birth rate lower than death rate. Then we will finish with the last question. So max gap. So which will have a max gap there. So the next question is which is having a max gap. So max gap. So max gap is will be in early expanding. So early expanding will have the maximum gap. So maximum gap will be in early expanding. So maximum gap will be in early. You can see here. Maximum gap will be in early expanding. So maximum gap will be in early expanding. Okay. So final question will come. Global hunger index includes all of the following. So global hunger index includes all of the following. If you see here, global hunger index, it includes 3 dimensions. So undernourishment, child underweight, and child mortality. So life expectancy will not come. So life expectancy at age 1, it is a part of PQLI. It is not a part of global hunger index. So global hunger index, we have 3 dimensions, so 3 indicators. One indicator for undernourishment. So proportion of undernourished population in the whole population, inclusive of adults as well as children, the proportion of undernourished population. Then underweight children. How many proportion of children under 5 years? Under 5 children, how many are underweight? So underweight or under 5 total. The total population, how many percentage are undernourished? The total population, how much people are having less nutrition. Under 5 children, how much are underweight. Then how many under 5 children are dying? Mortality of. So these are 3 things. 2 things for under 5 and 1 thing is for common. 1 thing is for adults and the children is for common, and 2 things are specific for under 5. Undernourishment, child underweight, and child mortality. Undernourishment, under 5 mortality, and underweight children, that is in under 5 underweight children. So these 3 will come. So global hunger index, India is in which category? Is India is in a serious category. So India global hunger index, India is in a serious category. So it is measured from 0 to 100. 0 means no hunger. 100 means worst type of hunger. So India is around 29.1. Okay guys, thank you. Thank you guys, we'll meet again. So for one question alone, I will search and tell you the answer. Somebody asked about the sterilization method for the tips. Sterilization method for a tip. Some tip they asked. Pipette tip. So pipette tip sterilization method around, I will consult and tell you. Okay guys, thank you. Okay guys, thank you. All the best guys. Bye bye. See you.